Imagine you're getting dressed one morning and suddenly feel a lump in your breast. Your heart starts racing. The first thought that comes to mind is often, is this cancer? But here's something important to know. Most breast lumps are not cancer. In fact, many lumps are caused by harmless conditions such as cysts, fibroadenomas, or normal hormonal changes. So, what should you do if you find a lump? Let's walk through it step by step. The first thing is, don't panic, but don't ignore it either. Book an appointment with your GP as soon as possible. Your doctor will ask a few important questions. How long has the lump been there? Has it changed in size? Is it painful? Have you noticed any nipple discharge, skin changes, or swelling? They will then examine your breasts and underarm areas. Depending on your age and symptoms, you may be referred to a specialist breast clinic. This is where something called the triple assessment is often performed. The triple assessment includes three things. First, a clinical examination. Second, imaging tests such as a mammogram or ultrasound. Third, a biopsy if needed. A mammogram is an X-ray of the breast and is particularly useful in older women. An ultrasound uses sound waves and is often used in younger women or to assess specific lumps. Now here's the part many people worry about the most, the biopsy. A biopsy simply means taking a small sample of tissue from the lump using a needle. The procedure usually takes only a few minutes and is generally well tolerated. The sample is then sent to a pathologist, a doctor who examines tissue under the microscope to determine exactly what the lump is. And this is important. A scan can suggest what a lump might be, but a biopsy gives the definitive diagnosis. So what are the possible results? The lump may be completely benign. Common examples include cysts or fibroadenomas. Sometimes the biopsy may show changes that need monitoring or further treatment. And occasionally, it may confirm breast cancer. If cancer is diagnosed, additional tests are performed to determine the type, size, stage, and the most appropriate treatment. The good news is that breast cancer treatment has improved dramatically over the years. When detected early, outcomes are often excellent. So remember, finding a lump does not automatically mean cancer, but every new breast lump deserves medical assessment. The earlier a problem is identified, the more options are available, and the better the outcomes tend to be. If you found this video helpful, please like, subscribe, and share it with someone who may benefit from this information. And remember, don't panic, get it checked.